Hello everybody, this is Carlos and welcome to a video on pericardial drains. A pericardial drain, as you can see here from a patient, is a tube inserted into the patient's heart around the pericardium to drain any fluids to enhance the heart's ability to pump properly. There are different setups for the pericardial drain. There's what we call the open system, as you can see here, and I'm going to show you also the closed system. Now, pericardial drain setups, they usually come in with a three-way stopcock. As you can see at this position is off to the patient, so nothing's going to drain out. As I open the patient's drain, as you can see to here, you should start seeing fluid being drained out from the patient. Now we're going to try to change it from an open loop system into a closed loop system. The reason why is because it minimizes the risk for air emboluses. It also minimizes the risk for infection because we don't have to open or potentially have the tube disconnect accidentally. So to start, perform your hand hygiene, as I'm going to do now. Gather your equipment, and in this case we're going to be using the Merit disposal depot. It looks like this, and this is the one we use in our hospital. And then we're going to put on gloves before we start the procedure. We're going to start by closing the drain to the patient so that nothing comes up, and we're going to put it off to the patient. Next, we'll open our Merit depot, followed by we'll disconnect this part from the patient. And attach our Merit depot back. Now, at this point, you're not done yet because nothing's going to flow off the patient. Please don't forget to open the drain back up, and you should see things coming up. In an event that you need to collect another sample, it's very simple. All you need to do, grab your 10cc syringe. You're going to undo the cap over here on this side. You're going to twist it in. And now you're going to close it towards the drain but open towards the syringe, which will look like this. Like that. So now fluid flow from here to here. And all you need to do is just pull to collect the pericardial sample. Once you have enough fluid, you just close it back to the patient, disconnect, send your sample. You're going to cap this back up, and again, don't forget to open this back up so that the drain is still draining for the patient, as you can see. Now let's change our dressing. In our institution, we change it every 2 days and as needed. Please follow your own institution's policies for this. We're going to start by removing the dressing. This is the chance for you to assess the site. You're going to use chlorhexidine, okay, and you're going to clean it 15 seconds on the site, okay. Do a good scrub. Chlorhexidine activates with friction. Flip it over and clean until both sides have been all used up. You're going to let it dry for 15 seconds, 15 to 30 seconds until the chlorhexidine dries up. Next, you're going to apply your gauze, and you're going to secure it with Medipore. If the dressing loosens up, gets compromised, please change it again.